Hello everyone, welcome to my channel. In today's video, I will be exploring the fascinating structure and function of the female pelvis with a focus on its role in obstetrics. Understanding the anatomy of the female pelvis is crucial for healthcare professionals involved in childbirth as it plays a vital role in labor and delivery. We will discuss the key components, variation in pelvic shapes, and how these differences can impact the birthing process. Whether you are a medical student, a practicing obstetrician, or simply curious about human anatomy, this video is for you. Let's dive in. What is pelvis? It is a skeletal ring formed by two innominate bones or hip bones and the sacrum and the coccyx. And what's the function of this means it is forms like a basin-like structure which connects the spine to lower limbs, and it is important part of the skeletal system, and it transmits the weight of the trunk to the legs, and it takes the weight of the sitting body, and it allows movement of walking and running, and it protects the pelvic organs. In addition, the female pelvis is adapted for childbearing with an increased width and rounded brim. Now we will see the types of pelvic bones. Types of bones. There are 4 pelvic bones that form the pelvis. Okay. So what are they? These are the 2 hip bones. Okay. These are the 2 hip bones, and this is one sacrum bone, and here it is the tail-like structure is there. No, that is called one coccyx. So one coccyx, one sacrum, and 2 pelvic bones. Here you can see the anterior view and posterior view of the pelvis, and the colors differentiate the types of bones. Okay. Now we will see the innominate bones. There are 2 innominate bones. So these are the hip bones, and each hip bone made up of 3 bones, okay, which are innominate, means that is not movable, okay. And this is the flat thing is called the ilium, and this is called the ischius tubosity, and this front part is called the pubic bone, okay, pubic bone, ischial and ilium. So now we will see the pelvic joints. There are 4 pelvic joints, okay. So 2 sacroiliac joint, one is right and one is left, okay. These are 2 sacroiliac joint, and one is coccygeal joint, and one is this is pubic symphysis pubic joint. This is one. So there are 4 joints are there in the pelvic bone. Now we will see about the pelvic ligaments. Pelvic ligaments is the tissue, connective tissue, which will helps the 2 bones to held together. Okay. So here are sacroiliac ligament, which will tie the sacroiliac joint, and pubic ligament, which will present at the top of the pubic bones, and sacrotuberous ligament, which will connect the 2 bones like sacrum and the ischial tuberosity on each side of the pubic bone, and sacrospinous ligament, this is also will connect the bone of sacrum and the ischial spine, and sacrococcygeal ligament, and this will connect the sacrum to coccyx. In this picture you can see the how the ligaments is connected to the pelvis bones, and this is the posterior view of the pelvis. Now we will discuss about the structure of the pelvis. Pelvis is divided into true pelvis and the false pelvis. The true pelvis is the bony canal through which the fetus must pass during the birth time, and it has brim, cavity and outlet. This is the pelvic brim or inlet, how it looks. Okay, it is formed by the sacrum posteriorly, the iliac bones laterally, and the pubic bones anterior position. Okay, and the shape is almost rounded with anterior posterior diameter being the shortest, and the boundaries are the sacral promontory and the wings of the sacrum behind the iliac bone on the sides, and the pubic bone is in the front. About false pelvis, it is the part of the pelvis which situated above the pelvic brim, and it got very little obstetrical significance, and the only function of the false pelvis is to support the enlarged uterus during pregnancy. Now we will see about the landmarks of the brim. Okay, so these are the fixed anatomical points on the brim. Okay, on the true pelvis, which will be plays an important role to know the stages of the labor. Okay, so these are the like sacral promontory, sacral ala or sacral wing, sacroiliac joint, iliopectineal line. It is the edge formed at the inward aspect of the ilium. And iliopectineal eminence, it is a roughened area where the superior ramus of the pubic bone meets the ilium. And pectineal line, pubic tubercle, pubic crest, superior ramus of the bone, then upper inner border of the body of the pubic bone and upper inner border of the symphysis pubis. Just you see here, it is there clearly. The picture is showing the anatomical points of the brim. Now we will see the diameters of the brim. Okay, it is very important to know because it will helps in the to know the stations of the baby's head. Okay, baby's head during the stages of the labor. That time it will be more useful. Okay, so there are 3 diameters of the brim: anterior, posterior and transverse and oblique. The picture shows that anterior posterior diameter, which is 11 centimeter. It is a line from the sacral promontory to the upper border of the symphysis pubis, and this contains 3 types of diameters, that is diagonal conjugate, obstacle conjugate, true conjugate, which are 12 centimeter, 10 centimeter, 11 centimeter in diameter respectively. Okay, the next is the transverse diameter, which is 13 centimeter, and it is the distance between the 2 farthest points on the pelvic brim over the iliopectineal lines. And the third is the oblique diameter, which is 12 centimeter either side, right and the left oblique, and it starts from the sacroiliac joint to the opposite iliopubic eminence. And these are the diameters you have to know. Now, diameters of the outlet pelvis. There are 3 types of diameters are there: anterior, posterior, oblique diameter and transverse diameter. Anterior posterior diameter is 13 centimeter, which extends from the lower border of the symphysis pubis to the tip of the coccyx. And oblique diameter is 12 centimeter, which extends from the right and left sacrospinous ligament to obturator foramen. And transverse diameter is 11 centimeter, which is between the ischial spine. Now we will see the types of pelvis. There are 4 types: gynecoid, anthropoid, android and platypeloid. Gynecoid pelvis. It is a normal female pelvis, has optimal diameters in all 3 planes. It's seen in 50% of women, ideal for childbearing. Next is anthropoid pelvis. It is like ape-like structure. Anterior posterior diameter is longer and it allows for easy delivery of an occiput posterior presentation of fetus, seen in 25% of all women, that is tall women. Next is the android pelvis. Normally it is called male pelvis. Posterior segments are decreased in all 3 planes and deep transverse arrest and failure of rotation of the fetus are common. In this, childbirth is difficult and also called heart-shaped brim. The next type of pelvis is platypeloid pelvis. It is also called flat pelvis and we will see in 5% of all women. In this flat female pelvis with transverse diameter, here arrest of fetal descent at the pelvic inlet is common in this type of pelvis. In this box, we will see the different features of the 4 types of pelvis, how it differs from the each type of pelvis in the brim, forepelvis, side walls, ischial spine, sciatic notch, subpubic angle and the incidence, how much it will be present. With this, we will come to the end of this video. I provided an overview of the female pelvis and its significance in the obstetrics. Okay, and it comprises several key parts including the ilium, ischium, pubis and sacrum, and I explored the different pelvic shapes, that is gynecoid, android, anthropoid and platypeloid, and how this variation can influence the labor and delivery. Understanding these anatomical and physiological aspects is essential for managing labor and delivery effectively. So stay tuned as we dwell into the intricate details of the pelvis and its pivot role in bringing new life into the world. If you have any doubts regarding the topic, just comment me in the comment section. I will clarify your doubts. Until then, take care. Bye. We will meet in the next video.